Good morning, everyone from British Columbia, or good afternoon, depending where you're joining us from today. Welcome to the fourth session of this year's CASA's annual conference. My name is Trevor Wally. I'm the program manager for AgSafe Agriculture Association in British Columbia. I'm also a member of the board of directors for CASA, and it's my pleasure today to be the moderator for this afternoon's session. AgInjuryNews, filling in the gap in agricultural injury reporting. It's a panel discussion, and we're very lucky today to have Bryan Weichelt, Dr. Roger Abbey, Scott Heiberger, and Dr. Serap Gorucu presenting. After the session, we will have time for questions, and we'll cover off some of the details on getting your questions in just a moment. Of course, we'd like to start with a huge thank you to our conference sponsor, John Deere Canada. Thanks to them, we are able to offer free registrations for the week. Housekeeping items as per the other sessions, your microphones and cameras have been disabled as we are in webinar format. If you have any questions throughout today's session, please use the Q&A feature at the bottom of the screen, and you don't have to wait for the question period to start putting in your questions. As soon as they come to you, you can start putting in your questions right away, and we'll cover those off as soon as we get to them. Closed captioning is available for the conference in 20 languages. It's located by clicking the closed caption button in the control bar at the bottom of your screen. You can click that to turn on captions and select the language when prompted. All presentations are being recorded and will be shared to the delegates following the conference. And if you require any of the conference presentation material to be translated, you can contact Megan Truxell at CASA. Her contact information can be found on the CASA website. And it's my pleasure now to introduce to you our speakers today. Bryan Weichelt, a research scientist with the Marshfield Clinic Health Systems National Farm Medicine Center. His research program focuses on efforts to improve the lives of farmers and rural military veterans, and has been directing the AgInjuryNews program since its 2015 inception. He currently leads several military veterans programs and projects within MCHS and chairs the 100-plus member MCHS Military Community Employee Resource Group. He earned his master's in information technology and an MBA prior to completing his PhD in biomedical and health informatics in 2016. Dr. Weichelt also recently graduated from the National Rural Health Association's Rural Health Fellows Program in February of this year and holds a WOC Research Scientist appointment with the Department of Veterans Affairs and is the holder of the Marshfield Clinic Research Institute's Stephen J. Miller Distinguished Physician Scientist Endowment in Rural and Agricultural Health and Safety Research. Dr. Roger Abbey is an engineer with 5 years' experience in agricultural engineering research focusing on safety engineering. Currently, Dr. Abbey is a research specialist at the National Children's Center for Rural and Agricultural Health and Safety within the National Farm Medicine Center of the Marshfield Clinic Health System. His work focuses on enhancing agricultural safety and health, addressing emerging technologies and traditional farming practices. He evaluates safety standards for agricultural machinery, identifies ergonomic risks, and aims to address gaps in current guidelines. Additionally, he researches farm fatality trends to provide crucial insights into major causes of injury, supporting targeted interventions to improve worker safety. He's currently analyzing Wisconsin farm fatality data for the years 2021, 22, and 23. Another of his ongoing projects is to identify effective sources of agricultural injury data and utilize them to supply the AgInjuryNews website. The AgInjuryNews is the largest data set of its kind, available through a web-based system that provides an interactive display of injury case data derived from news media and other publicly available reports. Ultimately, his goal is to create safer farming environments through improved safety standards, ergonomic solutions, and targeted safety initiatives. Scott Heiberger is a communications manager at the National Farm Medicine Center and National Children's Center for Rural and Agricultural Health and Safety, Marshfield Clinic Research Institute in Wisconsin. He manages media relations, edits and writes media releases and other center outputs, and is managing editor of the peer-reviewed Journal of Agri-Medicine. A former newspaper journalist, Scott is a member of the American Ag Editors Association and National Association of Farm Broadcasting. His background enables him to translate research and promote resources to key audiences. He's also part of the outreach team for Upper Midwest Agricultural Safety and Health Center. And Dr. Serap Gorucu is an assistant professor and agricultural safety and health state extension specialist at the University of Florida, Agricultural and Biological Engineering Department. Her research focuses on injury surveillance, risk assessment using AI-based ergonomic tools, and the development of safety interventions in agriculture. She also leads extension efforts in promoting agricultural safety practices and support individuals affected by agricultural injuries. Dr. Gorucu is actively involved in ISASH, ASHCA, and ASABE, contributing to multiple committees and conference planning initiatives. Welcome to our panel members. I'll let you share your screen and get started.
Thanks so much. Thanks for that introduction, and thanks for the opportunity to talk with everyone today about AgInjuryNews and some of the work and collaborations that we've been doing. I'll jump right in. Great introductions and a great team. A great team joining me today to talk about it, and a great team that works on AgInjuryNews behind the scenes and has been a part of the program for many years. And some of those folks are highlighted here, including Canadian Ag Safety Association's own Sheena, who's been a good helper for us and a good strong member of the team in collecting Canadian reports for quite some time. So I'll start off with a little bit of background, and then we've kind of got some slides to share with you about a few different sub-projects and pilot programs, and a little bit about rural news media. And I'm going to kind of set the stage and talk a little bit more about the background and kind of where AgInjuryNews came from. And some of this, of course, all of this first slide isn't a surprise, right? Agriculture, as we all know, is incredibly complicated, incredibly diverse, drastically varies in terms of work exposures and hazards and time to complete the tasks and the chores. And those commodity groups and those workers and workforces very drastically, right? Across countries, across states. Surprise, surprise, agricultural injury surveillance is also complicated and diverse and challenging. And this presentation isn't about agricultural injury surveillance or those complexities, but it is about news reports and publicly accessible data reports that are available that can help play a role to better paint the picture in terms of agricultural injury surveillance and what's happening kind of on the ground in agriculture in the U.S. and abroad. So a little bit of background. The program itself really stemmed out of the National Children's Center, the NIOSH-funded National Children's Center for Rural and Agricultural Health and Safety, some 12 years ago now, 10 years ago already. And before that time, there were a few other systems in place that really helped paint that picture that we talked about, including a NIOSH-funded National Institute for Occupational Safety and Health, a NIOSH-funded survey, but that came to its end and discontinued in 2015. There are, of course, other systems, other programs, other data sets. Again, we're not going to get into all of those today, but oftentimes they rarely paint the full kind of picture of circumstances around the injury, which is why, again, news reports and other publicly available data sources and platforms like that can help collect code and be redistributed quickly while also helping to kind of paint that picture and fill those gaps. And finally, as we all know, stories move people. Stories matter. Stories can move policy, and they do. This next slide is a compilation of reminders that I think we all see all too often in our local papers, online, right? Depending on the channels you follow. Certainly in our professional capacities, the four of us looking at the screen see these far too often, and are often reminded that the work that we do certainly is important. But these stories also remind us that these aren't just data sets. These aren't just charts and graphs. These aren't just numbers on a poster at an academic conference or on a slide at a webinar. Right? These are people. These are real families, real children. Far too often, real children. Younger brothers, older sisters, nieces and nephews. An empty seat at the family table. A stocking that's not hanging on the mantle this Christmas, right? These stories and these photos and these families are reminders for all of us that we can do better, that we need to continue to strive to help save lives, prevent injury on farms, not just in our local areas and our backyards, but across the nation and across the world if we can, right? So that's the one thing I think that's been incredibly powerful to be a part of this program is the reach that we've had as a collaborative group. So again, a little bit of background. Some of this work began back in the 90s with paper collection, literally paper binders and clippings. quickly became outdated, and I was brought on. One of the first things I was tasked to do as I came out of the Children's Center, Scott, you remember, back in 2014, was to help make it electronic. I think Barb had a vision at the time, Barb Lee, to have a spreadsheet, right, or some type of online file system where we could quickly find news reports that we were interested in, right? All the child-related tractor cases in Wisconsin. We wanted to pull those out and take a look. And we quickly said, look, we got to make this online. We have to make it available anywhere, anytime, anywhere in the world. And so we did. So we launched the AgInjuryNews platform as a platform of access, as a platform to better inform our stakeholders, as a platform to store and search and report on these types of cases quickly and easily and accessibly. And we always said from the start that this isn't going to be a comprehensive source of any official statistics, and that it would continue to be derived from publicly available reports, some of which are news media, social media, and obituaries. So we also formed a national steering committee, international steering committee. As you see, Marcel's name is still listed here as a former lead within the Canadian Egg Safety Association. That group has met several times in person once or twice as well, and we look forward to bringing perhaps a few changes to the list, but bringing this group back together in 2026. Every time I chat with Serap, who's going to nod in agreement, I'm sure every time I chat with Serap, she's like, yes, we should bring this group back together. We need to talk again. And that group has been instrumental and important in helping to drive many of the things we've done. The other piece, and I'll stop talking for a bit, is our system certainly has evolved as this collaborative hub, not just for sharing stories or writing news reports, but as a collaborative hub for science and research and studies, hypothesis generating discussions. And so we've been very fortunate to have a really strong group of peers and collaborators from multiple organizations be a part of a number of different pilot projects, some of which both Roger and Serap will talk about today. And Serap's going to talk a fair bit about data collection and coding as well, but it's just a quick kind of snapshot. Apologies if the font is a little small for you, but on that left side, those data sources, those are really some of the key data sources of where these reports are found, and then sent through our process to capture, code, and collect, and then decide whether or not we're going to include or exclude from our data system, which our team helps with every day. And so some of those key sources are really meltwater reports, Google alerts, submissions from several of our AIN Center colleagues, and then among others here listed. With that, I will pass the mic over to my friend and colleague, Serap, who's going to talk a little bit about coding and about an LLM pilot project that we had. So take it away, Serap.
Thank you, Brian. Yes, as Brian mentioned, behind the scenes, we have a team of people working on coding, entering the data to the system, and we want to be as consistent as possible for comparisons and reliability of the data. And in the next 9 slides, I'm going to talk about the 2 research studies we conducted by using AgInjuryNews data set. The first one was on coding agricultural injury factors affecting coder agreements. And as we all know, reliable and consistent coding is really important for any injury surveillance system. The reason is that we want to make sure that our data can be compared to the other data sources, and they can be interpreted correctly across different studies or time periods. So in this study, our goal was to understand how consistently agricultural injury cases are coded by 2 different coders. Next one. Okay, so how did we conduct this study? We had more than 1,300 agricultural injury cases. We used those data from AgInjuryNews data set. And we had 2 independent coders who reviewed and coded each cases for Farm and Agricultural Injury Classification Code, That is basically assigning if the injury case is farm-related or not. And also there are some codes for roadway incidents, transportation-related incidents, also fishing and logging-related incidents. The second coding system was Bureau of Labor Statistics, Occupational Injury and Illness Classification System to identify how the incident happened, the event categories, as well as the source, like what caused the injuries, those incidents. So after two coders independently coded the cases, we compared those codes and calculated agreement between the coders by using this different statistical methods to measure consistency. We also checked additional supplemental information. If we have additional information, how likely those information affect the agreement between the coders. Next, please. So as a result, in terms of farm and agricultural injury classification codes, as I said, we use more than 1,300 injury cases from the AIN. And we found that the coders agreed mostly 89% of the initial FAIC codes. This is really considered almost perfect agreement statistically. However, it depended on some categories. For some categories, it was lower than the others. Again, our limitation is the information provided by the narratives in the news articles. So as we expect, if we have more information, additional supplemental data, this improved the accuracy for about 20% of the cases. Next one, please. In terms of occupational injury and illness classification system coding, this system is a little bit about OIC system. The system is used by Bureau of Statistics for occupational injury and illnesses, work-related occupational injury and illnesses. They have a 4-level system to describe the different categories, different aspects. Can be nature of the injury, body part, source, and event categories. As I said, they have 4-level system. The main level is the first digit level. It's the main category. As the levels, the digits added more, it goes to more detailed information. As we expect, when we look at the OIC codes, we notice that agreement decreased as the coding became more details. When we add more digits, it means that the chance of having discrepancy between the coders, it increased. We also, again, similarly saw that additional information, supplemental information, they improve the accuracy. So it's important to have more and multiple data sources to achieve an accurate coding for each injury events. So this was the coding related agreement between the coders. Next one. This is the most recent study. We published this study in a journal article. This was on large language models for agricultural injury surveillance. So mainly we explored in the study how AI models, large language models like GPT and Llama, can assist in automatically coding or classifying injury reports. Next one. We use more than 5,000 AgInjuryNews reports, and we tested ChatGPT 3.5, GPT-4, and Llama 2 on injury narratives, and we then measured how accurately they could identify information like victim's role, type of incident, and other coding details. Our main goal was not just to test AI for accuracy, but also to see if this approach could help reduce the workload and cost of manual data coding. Next, please. this slide shows the victim level accuracy. Each colors shows different large language models. As you see, the accuracy level overall very high accuracy level, 84% for GPT 3.5, and Llama created the best results for the victim level coding. So as you see, drug information, for example, it had some different results between those three models. But overall, the accuracy was very high. Next, please. For the incident level accuracy, basically, we tried to see how accurately these models described what happened. We saw similar trends. Again, GPT-4 and Llama were especially strong performance, reaching close to 90% in accuracy. And this was really quite impressive for fully automated text interpretation. Next one, please. So in conclusion, we tested whether these large language models could help coding incident reports, and the results were really impressive. They matched human reviewers in average 90% of the time. We saw that LLMs can reduce manual labor, lower cost, and significantly speed up the data processing. And this is especially valuable for injury surveillance systems that rely on timely and consistent information. As we know that time is really important, and especially right now. So the takeaway is very clear. Large language models are very promising tools for reducing labor costs and also the time. So they can leverage these injury surveillance efforts in agriculture. Yeah, if you are interested in the study, I can provide the link in the chat. Thank you, Bryan.
Thanks, Serap. Appreciate it. I think it's just kind of great to highlight a couple of, interesting highlights or interesting side studies that have come from AgInjuryNews and the data and the collaborations. And so, thanks for sharing those updates. Appreciate it. Always cool to hear about it. Scott, I'll admit you distracted me with your Cubs mug. So Chicago Cubs, you guys aren't doing so well against the Milwaukee Brewers this week, but we'll have to talk about that at the end. Well, if somebody get Scott a Brewers mug. All right, let's keep chugging along the slide. So AgInjuryNews, who's using AgInjuryNews? This is kind of a nice segue over to Roger and some of the work he's doing. But if you've scanned the QR code or if you've already joined, you know that once you get to a couple screens in on AgInjuryNews to set up an account, we ask you to register. That's not to discourage folks. It's not to be a roadblock or a hindrance, but it's a way for us to get to know the stakeholders and the usage, and get to know who it is that's interested in the data, interested in the stories, and by and large, we've been able to do that with those registrations and with our email newsletter subscriptions as well. And so we won't have to get into the nitty-gritty details of your analytics, and we do track a fair bit of around the traffic and usage of the system itself, and it has continuously gone up year over year, and our global usage has expanded. We don't really know why. We don't advertise internationally all that much. We don't advertise internationally at all, I should say. We present once in a while at an international conference. But shown here on the screen, these are some of the pockets from which we see users visiting AgInjuryNews from around the globe. And then just briefly, the AgInjuryNews e-newsletters, they continue to be what I think one of the highlights of the capabilities of the program, right? Since we have these registrations, we have these folks' email addresses who are presumably folks who have taken the time to register an account to read about traumatic injuries and fatalities on farms, that they want to do something about the prevention, they want to learn more about the field and the discipline and what folks are up to. And so this e-newsletter that we send out quarterly isn't just about AgInjuryNews. We actually try to highlight more about other collaborators' programs, upcoming special issue in a journal or upcoming safety training or an event or a conference. And so that said, if anyone has anything you want to share, you want to get out to a broader audience, there's about 2,500, I think somewhere around 2,500 recipients of the quarterly newsletter. So if you have something you want to get in front of an audience, upcoming event or something like that, please feel free to reach out, let me know, and we'll be happy to get it included. And so one of the other pieces is a good segue over to Dr. Roger Abbey to talk about Wisconsin farm-related fatality reports, and we compile these every few years, and it's supplemented by AgInjuryNews data as well. So Roger, take it away.
Everyone, thanks, Brian. Thank you for the introduction. So the data set of the agricultural engineers can be used for several purposes. And one example, like one of the projects that we use for is the Wisconsin farm-related fatality report. So in this project, the main goal is basically to help identify the hazard and the risk associated with production agriculture. So it's a dual collaboration between the National Farm Medicine Center and the University of Wisconsin Medicine Extension. So far we have 7 reports on our belt from 2017 to 2023. In terms of data sources, beside the AgInjuryNews data, we use the Wisconsin Department of Health Services. We also get data from the Bureau of Health Information Death Certificate Registry and the news clipping from the state of Wisconsin. Brian, please, can you press next? Thank you. So basically how the report look like. In the report, we have 2 pages. On the first page, we first try to showcase the number of fatalities we have for the specific year we are working on, and the 3 years before that year. For example, on this one, you see we are working on the 2021. We have the number of reports for the 2020, sorry, and we have the report for the 2019, 18, and 17. The second thing that we do also in this report is that we want to make sure that the injury are standardized and reliable. So we use the Farm and Agriculture Injury Classification fake code. We use that code to classify all the injuries so that it's standardized and easy to understand by everyone. So in terms of classification, for example, it could be either just farm production, or it could be roadway collision, it could be farm hazard. In some cases, we are not able to classify them, so you just put like unclassifiable. We also identify the event that led to the farm fatality. For example, it could be either on-road transportation or maybe off-road transportation. Sometimes it could be just crushing injuries, or maybe fall, or maybe blunt trauma, things like that. So we have all this classification, and we literally count the number of injury per all of this classification, as you can see on the table over there. And at the end of this exercise, what we do really want to pinpoint is that in the area of interest, we try to discuss the major event that led to injury. In this specific one, for example, we find out, actually for several years, we find out that tractor was one of the major ones. So then in the report, we try to discuss a little bit why tractor is a major source of incidents, how those incidents related to tractor happen, and what can we do to prevent such incidents to happen at the state level in Wisconsin and at the federal level in the United States in general. Also, we discuss the source of injuries. In several cases, again, we have a lot of tractors, but beside tractor, we have skid steer, we have SUV, we have pickup truck, we have ATV, UTVs, we have trees, we have buildings, we have several types of source of injuries. So in those reports, we showcase exactly how many injuries or how many fatalities we have for each of these sources. And also, we look at some demographic information. For example, in the state of Wisconsin, only we want to pinpoint in every counties how many incidents we do have, so that we know which county has the highest number of cases compared to the other one. That can be very helpful for safety professionals to do targeting, safety educational intervention trainings, and so on. We also look at victim ages and victim occupation, as well, as we can see on the pie chart on the second page. One thing also that we do comment is that in this report, when we look at the data, we've seen a lot of cases related to suicide and homicide. In this report, we don't include them, but that's something that we usually comment at the end of the report that we do not include those suicide and homicide events. But if you are interested in knowing those, reach out to us and we'll give you more information regarding all of these suicide and homicide events. Bryan, can you please go to the next? Yeah, overall, this is the number of fatality that we have for every year from 2017 to 2023. Looking at these numbers closely, we see that from 2017 to 2019, we have an average, about 38 cases per year. But from 2020 to 2023, we have a slightly decreased average, which is kind of close, like 30, 31 or so, which is a good thing, right? We want to see that number keep, decrease as much as possible. And Bryan, can you press, please? Yeah, from 2017 to 2020, looking at the data closely, we see that definitely tractors and transportation roadways had a major source of incidents. A lot of accidents happen on the road, either both, roadways, on road and off road. We have a lot of cases related to those. And also looking at demographics, we see a lot of older men are kind of fatally injured in this. The majority of them, like from 80 to 90% of male. And most of them, like half of them, as you can see, 50% of them are older, 65 age and older. We also have, 15, 20% of youth involved in those fatality. Bryan, please, can you please? Thank you. And then on the opposite side, from 2021 to 2023, we see a lot of blunt trauma cases. And blunt trauma here basically means like such of like falling from equipment, falling trees, and roll over, overturned from tractors, from skid steer. We see a lot of cases. Those are the most popular ones from 2021 to 2023. Similar cases as like the previous 3 years. We see a lot of older men getting involved in those fatality, unfortunately. And we also do see 15, 20% of youth involved in those. These are generally like the major trend that we see in terms of these reports. Thank you, Bryan. Can you please go to the next page? And overall, I wanted to comment that, these fatality reports are, pretty popular and, pretty popular with the media. The National Farm Medicine Center released a press release alongside each report every cycle, including suggested social media posts. So it hosted online through the University of Wisconsin Extension Lab. As you can see, Twitter, you have a lot of media that kind of get to know and publish all these reports to make sure that you have a broader audience, that everybody can get to see it. Yeah. With that, I will transition back to Bryan to keep talking about the media on the next slide. Thank you, Bryan.
Thanks, Roger. Appreciate it. And before we shift over to Scott, Serap, you've done state-based farm fatality reports in Pennsylvania and now in Florida. Would you agree that the reception of media coverage is continually of interest?
Yes,
media typically gobble it up, yeah?
I was going to ask you a question, like what percentage just come from the death certificates, Roger? Do you have that information somewhere? Because I know from my state, many cases doesn't make to the news reports, especially it's my observation. There's nothing scientific, but especially Hispanic, Latino workers, heat-related fatalities, it's hard to find on the news media, and I mostly see them on death certificates, and we can identify those cases from the death certificates. It's really interesting. Like again, it shows using multiple data sources to see the bigger picture. Like otherwise, we don't see, we cannot identify, and we cannot see the whole picture for the prevention efforts.
Roger, anything to add there?
No, I think that's all for now.
Yeah.
Thank you.
I'll just add, I agree with you, Serap. I think just thinking back our exercise in combing through death certificates and the data that we get from the Department of Health Services, rarely does the full picture appear where we know, yep, that's definitely farm related and we know what happened. I mean, sometimes there's a fair bit of detail, but often we're left to check AgInjuryNews and do some Google searches, look for obituaries, look for a media release or some type of news about the event. But to your point, they're not all covered, and some of the obituaries are pretty quiet. They don't say a whole lot about the event that happened. They talk more about their life and less about the fatality. I think
one another comment. I want to comment on Roger's presentation. I know that in Wisconsin there is no fishing related. Is there any fishing related fatalities there? Fishing industry is not there, right?
Not many. I mean, we're surrounded by the largest lakes in North America, but not many commercial fishing related fatalities.
Yeah, my observation again from the death certificates in my state, fishing related drug abuse, alcohol related drug related fatalities, and suicides among the fishers, they are high. But that data, definitely that certificate data, it has its own limitations. So when an event happened, when an injury happened on a fishing deck or something, that's the work related. But if somebody after fishing coming home and doing those activities, we don't count them. But is there any relation or not? There might be. So we don't know. There are lots of limitations and unknowns. We cannot identify the whole cases. We cannot say 100% this is work related and this is not.
Yeah. No, it's a challenge. Every time we put it together, and circling back to media, media continues, I think, across the other states as well. I was going to name New York, Indiana, Illinois, Florida, Pennsylvania. A good handful of states compile these annual state fatality reports, and to the best of my knowledge, they're all quite popular with the media. And so I think a good segue. Scott, Mr. Heiberger, if you wouldn't mind, please indulge us and take it away.
Yeah, I'll put down my Cubs mug for a minute. It's been a rough week for us, but the mug does honor their World Series victory. So maybe the Brewers will have a World Series someday. That's all I can say. Well, thanks. Great setup. Our center does work quite a bit with media. We are trying to reach the same audiences, and media have been great partners for us. When media professionals report on safety, they tell us that they need two main things: statistics to provide context. How often does this happen? How often does this happen in my area or my state? The farm fatality reports are heavily used by media. They absolutely they really like those. They request those. When they come out, they jump right on them. It's very valuable to them. And then they also need a story, something to grab readers' attention. There's a perception among media that safety's it's boring, and they need something to hold the attention of the readers so that they can get to some of those statistics and get to some of that perspective. AgInjuryNews has been a great media relations tool because of the fact it's got statistics and stories. And I should say too, just by way of definition, when we talk about media professionals, we're talking about journalists, sort of your traditional media, farm broadcasters, but we're also talking about any sort of ag communicator, communication specialists with farm advocacy groups, with commodity groups, with insurance companies, marketing agencies, anybody who communicates within the world of agriculture, we're trying to work with and work with them on safety messaging. Next slide, please. The sad reality is that AgInjuryNews is well positioned to help media because there's an inclination when if you're a media person and you don't cover safety very often, or you don't cover a traumatic injury very often, your first inclination is to grab some numbers or hang the story on that incident. Research tells us, and the reporters themselves tell us, that traumatic events are the primary motivation for most stories related to farm safety. It's not too often that someone's kind of enterprising and they'll say, I'm just going to do a compelling story on safety, and it just tends to come with the injury events. we see a missed opportunity there because research also tells us that the overwhelming majority of these injury event stories don't contain a prevention message. And that's something that could be a goal for all of us here on the call, that this is a real opportunity to try and inject safety messages into these news reports. And, we try to maintain those relationships, cultivate those relationships so that when something does happen, the media will call us. And then we're able to talk to them about the fact that this is not really an accident. It's something that could have been foreseen, and it's something that most likely has happened before. And we can maybe try to get out of the mindset that stuff just happens and that's farming for you. That we can be proactive. Next slide. And just a word about the changing media landscape. You probably sensed this was happening, but the U.S. has lost about 1/3 of its newspapers since 2005. And from a media relations perspective, and the same holds true, they're talking about newspapers here, but we've seen a lot of consolidation with farm broadcasters, radio stations in small towns. Now you'll be on the internet and you'll look at on a website and there'll be 4, 5, 6 stations, and one will be country and one will be talk radio, et cetera. So point being that there's a lot of consolidation of the news outlets that remain. And so from our point of view, it becomes easier to reach larger audiences with safety messages. If you can do one interview, then there's a chance that your interview will be shared across the rest of that local radio group or with dozens of other stations as part of some, one of our ag news networks. Now, from a data collection point of view, and I can't speak to that, that may complicate things with fewer outlets. I don't know. In conclusion, I would like to leave you with a good example of how media use AgInjuryNews. This was a reporter for the publication Politico, which covers a lot of news and policy and politics. And he had, to his credit, written a story about the landscape of ag safety in the United States and got into immigrant labor and the family farm and really did a fantastic job. And he had all that done, but he was looking for an anecdotal lead, something to pull people in, something to catch their attention. He went to AgInjuryNews. He just started poking around, and he was based in the DC area. So he found a incident, I believe it was a tractor fatality in Virginia. It was within driving distance of where he was at. So he followed up, contacted the family that had lost a family member a few years earlier and interviewed them, and came up with a lead that drew people in and caught people's attention so that they could get to the rest of the really good reporting he had done. So definitely good ways to use AgInjuryNews with media, and it's a tool that we fall back on quite often. And I'll say one thing too, that when it was established, Bryan, you were talking towards the beginning about the beginning of the evolution of AgInjuryNews. One of the first things we did was at the Ag Media Summit, which is the largest annual gathering of agricultural media in the United States. We did kind of a informal survey, and we asked them, if such a database existed, would you use it? What would you like to see in it? What would you like to have it contained, et cetera? And they gave us some pretty helpful advice on how to set such a database up. And so from the very beginning, we've included journalists and media in how we package AgInjuryNews and how we try to maintain it. So that is all I have.
Thanks, Scott. I guess I got one more slide here of some final concluding notes. Then I don't know if the panelists have some other kind of final thoughts before we transition over to a bit of Q&A time. Looks like we're going to have a little bit of time left over. So in conclusion, and I've kind of added this one in, this first bullet I added earlier this year as it's not just a U.S. challenge this year, but federal funding has shifted a little bit in federal funding priorities and research and so on and so forth. And so while the National Children's Center and NIOSH, has gone through some ups and downs this year, and with some question marks for the future, the AgInjuryNews program has shifted over to the National Farm Medicine Center's donor-supported program and the endowment support. And so we fully anticipate that it will continue to live on, has been unwavered in through these ups and downs, and for the foreseeable future will continue to be funded through those other programs, which I'm excited to report. And I think that as collaborators come and go and come on board and are interested in the program, it's often a question, right? I was like, what's the future look like? And how are you going to kind of continue to fund and pay for the staff to do the daily work of coding and collection? Same with the second bullet there, continue to develop and to distribute these e-newsletters. They're a valuable and important component. I encourage you to sign on and to receive those, but also participate. And if you have material you want to send out, let me know. Reach out and connect. I mentioned the steering committee earlier, and as well as these studies, I'm optimistic that this ongoing research studies and outreach projects and this pipeline of new ideas will continue to come through. I'm not sure, looking at the screen at Roger and Serap, how many grad students or interns we've worked with in recent years on different projects, but I fully anticipate that to continue and to continue to grow and evolve, and a lot of exciting opportunities there. Scott, I think, talked a fair bit already about the media and the reporting and potential, but also in terms of changing and shifting terminologies and use from accident to incident and other types of terminologies to utilize this as a platform and an opportunity to inject interventions into media reporting itself. And so I think maybe that warrants a panel discussion in and of itself on a different day, but we look forward to that opportunity. And changing the way that the media and the way that others talk about traumatic injuries on farms, that they are preventable, and to shift the terminology in a way that talks about prevention rather than accidents or accidental behavior. And then finally, always open to collaborations and international partnerships as well. And I'd be remiss if I didn't bring up the team and show them again. The core team highlighting the photos on the right is a part of the daily work, but there's also kind of the data team and the technology team that have gone into developing the program and the system and the platform, as well as kind of our internal advisors. And so thank you to all those folks. Thank you to my fellow panelists. I think we got some time for some Q&A, so I'll pass it back.
Well, thank you all so very, very much. That was a fantastic presentation and a great review of a ton of information there. Very, very usable, and a couple points that came up for me right away, right off the bat. Serap, you had mentioned that consistency in coding, and I was already opening up the article that you sent out in the link to those who want to open up the chat function. There have been a few links that were shared with everyone. That consistency in coding just allows for the creation of reliable statistics. If you have 6 different ways of naming one thing, how you add them up at the end of the day is really going to be all over the map. So that's such an important piece of it. There are a couple of questions coming in, but I'm going to just use my spot here to ask my question first, if I may. In your data sets, where you're gathering your data from, is there any way to use or collect from social media sites like Facebook groups or Reddit threads or that sort of thing? Understanding that, of course, there's the need to verify, but where pieces are being missed, are those sources being used yet or being checked to see if they can be used?
Yeah, I'll go first. So we have had a few project proposals come together, and certainly have tossed the ideas around to more formalize and come up with a more structured, systematic collection from different social media channels. While those haven't come to fruition in a systematic way, we do utilize different social media to better inform or to confirm that a case happened. GoFundMe, we consider a GoFundMe page a social media page, similar to an obituary, but they have become original source information for some of the cases that we wouldn't have already known about. But yeah, we do certainly come across social media in a number of different ways. And of course, social media in and of itself, they like a media outlet, like Channel 7 News from Central Wisconsin has a Facebook page, right? And so oftentimes those will also come up in searches and come up through Google results. So it's helpful in some other fashions beyond more traditional sources. I don't know if the other panelists have a response to that.
Great. A couple of questions coming in. One from Carolyn. Our organization, Ag Health and Safety Alliance, references your organization and how to access the data in all our Gear Up for Ag programs in the U.S. In the presentation and in their e-learning course. Can you please remind of how the reach into Canada, since we have many programs in 7 different provinces?
The question: how does AgInjuryNews reach into Canada?
Yes. Yes.
Yeah. Hi, Carolyn. Thanks for joining. Good to see you again. Yeah. So through Canadian Ag Safety Association, AgInjuryNews had made a connection years ago. Marcel, former director over there, had been a member of our steering committee, and folks from the Canadian Ag Safety Association have been a part of the data collection team for several years. I forget the year that it began, but yeah, I would encourage to reach out, and if there's potential for further growth, either through safety training or ag training or through data collection, happy to have those conversations.
Great. Another question here. We've heard lots this week about the importance of stories in communicating farm safety. When media tells these stories, do they always have to involve cautionary tales, or are there less traumatic ways to use the stories to our advantage?
What do you think?
Well, there is a concern sometimes, maybe media hold back from inserting a prevention message because they feel like they don't want to pile on or appear as judgmental. And that may happen kind of ironically. Maybe the less a reporter knows about agriculture, maybe the more hesitant they are, because they just don't want to stick their neck in someplace. But of course, if we have a chance to work with them, and all of us on the call know that there are ways to do that. There are ways to generalize the safety message and not say, boy, this particular farmer really screwed up. That's how AgInjuryNews can be helpful. Well, this is one of 7 such incidents this year in the United States, and safety experts always recommend to blah blah. So, there are ways to take the spotlight off the individual in that particular incident and broaden it out. So that's maybe something we can do a better job of helping media with, so they don't feel like they're being judgmental. And you know what, the same would go, and probably see some heads nodding. The sheriff's departments, the people who fill out the incident reports, we get the feeling that in some locations that there's a similar thing at work, that the sheriff or the deputy will, maybe know the family personally, or, know the town really well, obviously. And so there's maybe a hesitancy when they word their news releases, which are the things that a lot of news reports are based on, that they might be holding back a little or sugarcoating a little.
I can see both sides of that completely. Yeah. I'm not seeing.
I just add one more thought to that, if that's all right.
Yeah, please.
I agree with Scott, and I think I think one other element probably warrants a study in and of itself. But if there's any journalists or media reps on the call, I would challenge you to maybe shift perspective and think about prevention a bit more in this coverage of these stories. And I say that through the lens of we all know advertisement dollars are certainly important for the survival of whatever the outlet may be, certainly with small rural papers. And so the clear, to me, clear and obvious, maybe hindrance to certain types of coverage, maybe, who's paying the bills, who's keeping the doors open, and whether we would admit to it or not. Certainly those advertisers must have some influence over the way that these stories are conveyed or written, if at all. And so I think that's just a thought. I think there's room for some further discussion around small rural papers and the coverage of traumatic injury in an article on the same page that is heavily advertised by agricultural equipment and business. And so I think to Scott's point, I think there's some strategies and some kind of clever and careful ways that these stories can be written in a way that doesn't poo-poo on ag, right? I mean, that's the tricky part. Like, how do you make ag still be the cornerstone of the community, and how do how do readers kind of maintain that pride as we all have in the field for the food that we eat, while still acknowledging like it's freaking dangerous. Like, kids are being killed, and growing farm workers are dying from the heat, and like we can still talk about it in a way that doesn't poo-poo ag. So I don't know. I don't know if Scott, I know we've talked about this a number of times. I don't know a clear and obvious solution, but I just wanted to share those thoughts with you.
It's a balance of the age-old media statement of if it bleeds, it leads, balancing with an information or education session, but somewhere in the middle is, providing the baseline information of what happened, but also here's the importance of this activity, sort of thing. And it'll be a case-by-case basis from everything I've seen and many of the stories I've read myself as well. So yeah, a challenge, but I think it's one that if media has the time to spend a few extra minutes on each story, they can rise to it. Another question has come up. Thank you, Robin. Have there been any surprising findings when you've gathered the data, i.e. occurrences of injuries relating to things like spray planes or other things that we might not otherwise think of are agriculture related? And Robin also has a very important message at the end of her question here, which is go Jays, go. Just throwing that out there for you. Any wild surprises or things that caught you off guard or really thought were unexpected when reviewing incidents or data? The outliers, if you will. And the silence. Oh my goodness. Okay, yeah. When it's silent there, apparently I'm supposed to keep talking. Bryan, you're about to say something.
Yeah, no, I was going to pause and let the other panelists. I feel like I'm talking too much.
Yeah, I don't know if it's surprising, but the surprising part is how many other people dies from the transportation related incidents. They are not working in agriculture, but they are sharing the same road with the agricultural vehicles. To me, it's like everybody should pay attention to the agricultural vehicles on roadways. This is not just for farmers. This is not just for farm workers. This is for everybody's safety.
And that's come up in the past at ISASH meetings with the Tractor and Equipment Committee. Yeah, sorry, Roger, you're about to speak there.
Yeah, I was about to say that I was actually very surprised to see when we review the Wisconsin fatality report from 2021 to 2023, we see a lot of suicide incidents. So to me, it was kind of surprising to see how many farmers involved in those suicide events. Yeah.
Yeah, I'll just add, I agree with both of those. And to Serap's point, the number of public roadway incidents kind of raised the alarm for us and our team in Wisconsin several years back, where we launched a slow moving vehicle and kind of lighting and marking initiative and campaign, and we're able to raise some funds and give away slow moving vehicle signs, the orange triangles, to Wisconsin farmers for the last several years. I think it's it's sometimes difficult to quantify, right, in terms of reduction of injuries and fatalities, but there's more on the roadways, and folks are talking about it. But the surprising piece to me is when I still see a piece of agricultural equipment driving down the highway that's unmarked or unlit in the hours of darkness. And it's like, in my mind, a blatant disregard for the law as well, and your fellow motorists. The other surprise that I will add, not surprised to see it, but surprised to see it continue so much, is the children being injured and killed on farms in ways that we would think we should know better by now, right? That maybe it's not the best idea to have the young child riding on your lap on the tractor or on the lawnmower or those types of things. And so, as I mentioned,
I don't know the injuries or fatalities to children in Canada, but in the US, in some states, in Pennsylvania, it's like one third of the fatalities, they were to the children, especially the young, very young children. They were under a lot of risk. But in other states like Wisconsin, it shows 15-20%. Here in Florida, it's very small, maybe less than 1%. That is a good news. But I know this depends state by state, the percentage changes.
Robin, just throwing in there, kids under the age of 4 in Canada have the highest fatality rate for any age group under 65, and that's from the CARE report.
Wow.
So within agriculture, if you're looking at age groups, it's under 4 for the groups in Canada. The 4 of you are spread out all over the place. How often do you guys get to meet in person? Is this a thing that happens very often?
Not as often as we'd like. I can't speak for them. I think not as often as we'd like. Maybe
I
once a
think
year.
the best way to meet in person goes through the conferences. ISESH, ASHCA, we are attending. Those are the venues we can meet and talk.
Well, I think we're reaching the end of our allotted time. Is there any last message you wanted to put out there? An unplanned question from me. There you go.
Thank you for hosting. Thank you for the invitation. These events matter and bring people together and talk and inspire and motivate us to continue to do our work. So thank you.
And thank you all. Another great example of how the border is just a line. The information that's gathered can be used on both sides of it, and boy, oh boy, it sure is so important. The sharing of the stories in the data is universal as to how something came to a situation where it happened and created an incident is the most important piece to share, not just the data, and that's so vital. So I'm really glad you all were here and able to share this. Thank you so much to all of you, Bryan, Roger, Scott, Serap. Thank you so much. And thank you to everyone for attending today's session. The conference will be back at 11 o'clock tomorrow morning. That's Central Time, rather, for exploring harvest safety with the WSPS from road safety to resilience. And once again, thanks to our conference sponsor, John Deere Canada. Thanks to them, we're able to offer the free registrations for this week. And the Zoom link that you use to get into this session is the same one for tomorrow's session. And we ask you all to have a great rest of your day, and please be safe out there. Thank you very much, everyone.